In 1918, an invisible enemy swept across the world, infecting 1/3 of the global population and claiming millions of lives. This was the Spanish flu, one of the deadliest pandemics in human history. But what made it so catastrophic? How did the world respond? And what lessons can we learn from it today? Let's uncover the story of the Spanish flu epidemic. The Spanish flu didn't actually originate in Spain. In fact, its true origins remain debated. Some theories suggest it began in military camps in the United States, while others point to China or France. However, the name Spanish flu emerged because Spain, a neutral country during World War I, was among the first to report the outbreak openly, while other nations censored information to maintain wartime morale. The first cases appeared in early 1918. Soldiers in crowded barracks and trenches of World War I became perfect carriers for the virus. Initially, the symptoms seemed mild: fever, chills, and fatigue, much like a seasonal flu. Most people recovered quickly, and authorities paid little attention. But the virus was mutating, and preparing to strike back with unimaginable force. By late summer of 1918, the virus had transformed into something far more lethal. The second wave hit with full force in September, spreading across major cities in Europe, North America, and beyond. Unlike common flu strains, this one targeted young, healthy adults with devastating consequences. Victims developed severe pneumonia, their skin turned blue from lack of oxygen, and many died within hours of showing symptoms. The Spanish flu spread like wildfire, infecting over 500 million people worldwide. No continent was spared. Hospitals overflowed, makeshift morgues were set up, and entire communities were wiped out. In India alone, the death toll reached over 17 million. The virus did not discriminate, it claimed soldiers and civilians, the rich and the poor alike. Even remote islands and indigenous populations suffered immense losses. With no vaccines or antibiotics available, governments struggled to contain the spread. Social distancing, quarantine, and mask mandates were enforced in some cities. Public gatherings were banned, schools and businesses shut down, and people were advised to stay indoors. Yet, misinformation and resistance to health measures allowed the virus to continue spreading rapidly. By early 1919, a third wave emerged, though it was less severe than the second. Slowly, the virus began to lose its strength, and cases declined. By late 1920, the pandemic had largely faded. In total, an estimated 50 million people lost their lives, with some estimates reaching as high as 100 million. The Spanish flu left a lasting impact on global health and medicine. It led to the creation of better disease surveillance systems, increased funding for medical research, and greater emphasis on public health infrastructure. Governments realized the need for coordinated responses to future pandemics. Scientists also studied the Spanish flu to understand how viruses mutate and spread, paving the way for modern flu vaccines. The Spanish flu serves as a grim reminder of the dangers of pandemics. A century later, we faced another global crisis with COVID-19. The lessons from 1918, early intervention, transparency, and global cooperation, remain just as relevant today. While science has advanced significantly, the need for preparedness, awareness, and collective responsibility remains crucial in our fight against infectious diseases. The Spanish flu was one of the deadliest pandemics in human history, but it wasn't the last. As we navigate the challenges of modern diseases, remembering the past can help us build a safer future. History teaches us that pandemics can be devastating, but they can also lead to progress. What lessons do you think we still need to learn?